It's Friday, April 24th. I'm standing in Spanish Plaza to kind of do a recap of the week. Last Friday, I told you I was anticipating coming into this week to see what the data would show, talking about the surge. Well, based on measures that have been taken, mostly you staying at home, we didn't have a surge. If there has been one, it was actually probably 2 weeks ago, because ever since that point in time, the percent of increase of our cases has actually been declining. We never maxed out our hospitals or ventilators, which is all great news, but that doesn't mean that the virus is not here. It just means that a lot of people did the things they were asked to do regarding hygiene, about staying at home, and those measures. The good thing to know about all that is that, if there is some anticipation in the future that we're going to have an increase of cases and maybe the hospitals are going to be at capacity, we know there are things we can do that again will bring down the increase in cases. So in reflecting on this past week, it was really about starting to prepare for, what does it look like with the relaxing of the regulations of the stay-at-home order from the governor. So we've been in conversation with the governor's office in anticipation of maybe what will be done. I think she's still analyzing the data. She's still talking to experts in various fields, trying to determine, what it will look like. But I would expect, as she said, by April 30th, you will be hearing from her about what Alabamians can expect. Within the city of Mobile, it's very important that whatever her order says, ours has to fold into that. So we'll be waiting to see what she says, then we'll come out with what we'll be doing. When I think back over the past week and some of the things that were unexpected, that were not on the good side, that would be, the things that happened regarding our nursing homes. Starting really last Saturday and Sunday, the numbers started coming out of the increased number of deaths and the increased number of cases in the nursing home. We responded from the city's perspective, trying to make sure that any personal protective equipment that we had, we got it to the nursing homes. Also this week, we had more collaboration with the county and with the Department of Health and what we're calling the Unified Command, which is really an organizational structure which makes it easier for us to collaborate and to make collective decisions. And we will continue doing that going forward. As I think about next week and what it holds for us, I really would like to back up to the last 6 weeks and what's occurred in the area of communications. And we have developed a process or processes where we feel like that we have feelers out into every part of our community getting feedback of what's going on. Whether it's me actually being out in the community, walking through stores, or whether it's the Zoom conversations that we're participating in, whether it's part of our staff that's on Zoom calls. But if I were to guess, I would say during the course of a day, we're in communication with something on the order of 20 to 30 times more people than what we typically have been, as far as us being able to hear what you're saying, to listen to your concerns, and also to help us with ideas of things that we can do to help, smooth this pathway going forward. We hear you loud and clear. You're worried about your health, but you're ready to go back to work. And so we're trying to make sure that when we go back to work, that you're going to be safe and not find yourself, either in the hospital or at home being sick. So we appreciate the feedback we're getting. We just would hope that you would realize that as we go back to work, that doesn't mean all of a sudden you just quit washing your hands and you quit the social distancing and everything is fine, because it's really not. But we're really grateful to the restaurant owners, to the barbershop owners, to the hoteliers who have given us information, very valuable information, to help us make the very best decisions. And so we'll continue to do that just to make sure that we can not only just start back to work, so that we can, ramp this up at the right time, because, no businesses were really made or built to operate at half speed. I mean, everybody is always trying to, seat another table at the restaurant, or sell another car, you know, or to cut another hair, have another haircut, you know, during the course of the day. We understand that, but we're going to have to ease into some of this stuff before we'll be able to hit our stride and really go. But please understand, we think we know that where you are, and so we're going to continue to use our influence with the governor's office, with the governor, to try to make sure we make the best informed decisions. So thank you very much.